Number one, it is very important. What we are really trying to do is to be as accurate as possible, to create a complete study. So first of all, we've talked about some of these differences. First of all, it is in regards to using a treadmill protocol rather than a bike. The reason for that is that a treadmill is more natural to most people in regards to walking, and it actually provides more stress on the heart than a erect bicycle. Secondly, we've talked about our ramped protocols, and we believe very strongly that they are very helpful in ensuring that we are able to adequately stress the heart. You know, to have a patient that stops at 3 minutes because of a sudden severe exercise is inadequate for what we're doing. We need at least 6 to 12 minutes of exercise so that the stress on the heart we've given time for the measurements to go from being normal to abnormal. Next is the quality of the equipment. The echocardiographic machinery is a very important component, because there are patients come in all sizes, and in some patients where there would be traditionally difficult imaging, by having a more high power machine, we're able to get better images. In addition, we've talked about how we are using a more complete baseline study. There are other causes of chest discomfort, and what we're able to do is, in that baseline study, we find other causes of chest pain, such as a narrowed aortic valve, or a leaky mitral valve, or pericarditis, which is an inflammation of the heart, or patients with other diseases of the heart muscle called cardiomyopathies, which are other causes other than having narrowing of the arteries. In addition, it is the 7-image protocol in which we use it as well as at rest and post. A lot of other people only use 4 or 5, and we believe that these additional images are really helpful in classification of exactly where the narrowing is. They're taking pictures of the left ventricle, and the coronary arteries are like hands round a football, and the left and the right coronary artery are like trees. They have a trunk and then major branches and smaller branches. And what we're doing by taking these extra images, we're trying to be able to be more specific about where a narrowing is, because we know that taking less images, we miss some abnormalities, and that's why we've gone through extensive experience of realizing how to become more accurate. This is a very important test. We do not want to send a patient out who has a serious problem with a negative test, reassuring him incorrectly. In addition, there is additional value of the stress echo in the fact of triaging, in the fact that we can separate people with really severe problems that really need immediate therapy versus patients that can be managed as an outpatient in a more routine fashion.